So the first 2 years after you get your first period, in general, you're likely to experience some changes. So you may get it for 1 month and then you might skip 3 months. And then you might get it the 4th month and then you might skip another few months. And this is perfectly normal. And it's because your body is just getting adjusted to all the changes. But after about 2.5 years of getting your first period, if it's still irregular, that's when you need to look into it. Now, what are the signs of having a period that's not healthy? One, you bleed too much. Now, how much is too much? A lot of times we tend to think that, you're bleeding in liters. You're not. The maximum you would bleed is around 60 ml. 35 to 60 ml is the normal quantity every month. So anything that exceeds around 80 ml should be a cause of concern. Now, how do you know it? The simple rule is, if you have to change the product, whether it's a pad or a cloth or a tampon, every hour, you have to change it every hour, that's an indicator that you're bleeding a little bit more. Now, usually if you have excessive bleeding, chances are you could also be anemic. That means your hemoglobin count would be less. So for a healthy woman, your hemoglobin should be anywhere above 12. So if it's less than that, and especially less than 8, it's a cause of concern. Now, if anemia happened first for you, that is, you are anemic for some reason, then the result could be that you bleed too less because there isn't enough blood. So these are some things you have to watch out for. Additionally, there are vaginal infections. Now, a lot of times we feel embarrassed to talk about it. Period is still something we might say, but how do you know if you're having a vaginal infection? So the signs of that are, you have excessive white discharge. Now, normally all girls will experience some amount of white discharge during ovulation. It's nothing to worry about. But if you have a bad odor accompanying it, or the texture is thick and curd-like, or the quantity is just so much, then it is a possibility that there is a vaginal infection. Again, nothing to worry about because all of these can be treated. And of course, the other sign is period pain. Now, it's become so common, so many girls have it, that all of us tend to think that it's okay, it's part and parcel of having a period. It's not. You should not be experiencing pain during your period. And if you are, that means you're not doing things right, especially with your food habits. So a week before the period, if you're not eating right, if you've been traveling or doing too extensive physical exercises, or if you've been stressed out, maybe because of exams, then that would show in your period. So it's an indication that you have to fix those things. Of course, you can take painkillers, but in the long run, that's not going to help you, because any medicine that you take will work for a while, and after that you need higher doses of it. So you don't want to end up pumping yourself with medicines when this is something that you can handle naturally. But if it's a problem like excessive bleeding or anemia, then do go to a gynecologist or an Ayurvedic practitioner and take medicines to fix it. Because you may not realize, but you will go into a loop of feeling tired, exhausted, not being able to concentrate. These are all signs of anemia. And anemia is so related to the food you take. So if you aren't eating food that is rich in iron, you're likely to have anemia. Or if you have heavy menstrual bleeding, you're likely to have anemia. So these are things that you should watch out for.